Today, we're so lucky we have Dr. Fariha Jamal. She received her MBBS from King Edward Medical College in Lahore, Pakistan, and completed a clinical fellowship in movement disorders at the University of Kentucky College of Medicine. Dr. Jamal is an associate professor of neurology at the Baylor College of Medicine, deputy executive neurology care line at Michael E. DeBakery Veterans Affairs Medical Center, and Assistant Clinical Director of Parkinson's Disease Research Education and Clinical Centers at MEDVAMC in Houston, Texas. Thank you so much for being here with us today, Dr. Jamal.
Thank you so much for having me, and thanks for the kind introduction. So let me share my screen before we get started. All right, can you see my screen okay?
Yes, thank you.
Perfect, okay. So as Ms. Bellman stated, that my name is Fariha Jamal, and I am a movement disorder neurologist situated here in Houston, Texas. And today we will be talking about different kinds of tremor, how do we differentiate between them, and what is the approach when we are talking about treating these tremor, either medically or surgical options if possible. So what is tremor? Tremor in general, when somebody says the term, means shaking. But if we want to refine it more, then it means a rhythmic kind of an oscillation or vibration of a body part. And it can involve any part of the body, but the most common tremor that we see is in the hands. And out of all the abnormal movements that can happen to an individual, tremor is the most simplest movement disorder. And it is also one of the most common movement disorder as well. And the way it is described is the way it appears. So we can say that an individual may have rest tremor. So rest tremor, as the name depicts, is a shaking phenomenon that happens either in the hands or any other body part at rest, when an individual is completely still and there's no movement or even the effect of gravity exerting on the body part. On the other hand, there could be other kinds of tremor if somebody is maintaining a posture. So as an example, if the arms are lifted and they're raised in front of the body, or if an individual is doing something and their hands are still in that position, then that is a postural tremor if somebody experiences shaking during that. And then kinetic tremor, again, as the name indicates, that is a tremor or shaking that happens when the body part is in motion. So whenever we hear somebody telling us that, that they have shaking, there are a few things that we really want to elaborate in order to get to the root cause of the problem, as well as also determine that what could be the likely cause and how should we treat it. So the first thing which is important is age at onset. And the reason age at onset is important is because there are different kinds of tremor that are peculiar regarding their onset at certain ages. So we'll be talking more in detail about essential tremor, which is the most common type of tremor. But I'm going to use that as an example as we talk about these different bullet points on this slide. So age at onset regarding essential tremor can happen at a very early age. There are actually two kind of peaks as far as age of distribution goes. And it can happen or start in individuals' 20s, or it can happen in 60s. And again, the age at onset, it tends to determine in certain individuals that how the tremor is going to progress and how it is going to respond to medication. And the age at onset also tells us that what is the duration of the tremor. For somebody, the tremor may have been around for 5 years. For somebody, it may be 5 months. And for some individuals, it may be present for as long as 15 years before they seek any medical attention. Then we want to know, of course, that which body parts are affected. And as I said, that hands are the most commonly involved body part that is affected by tremor, but it can involve any other part of the body, ranging from head. An individual can have head tremor. There could be voice tremors. A lot of individuals, they have a quivery voice that we can elicit if we ask them to do certain things. For example, we ask them to do ah or e, and during this prolonged consonants, we may hear some quivering, and that gives us an idea. And in some individuals, the tremor in the speech or voice may be so pronounced that in normal conversation, we are able to hear it. Similarly, an individual can have jaw tremor. So jaw tremor again is something which could be very peculiar to essential tremor. And if we see somebody having jaw tremor while they're talking, it gives us a clue that it could be essential tremor. On the other hand, if somebody have tremor in their jaw when their mouth is closed, then that could be a hint that this could be related to Parkinson's disease. Again, these things don't happen. They are not that fixed in their sites, but it just gives us an idea that what could be the underlying cause. Similarly, there could be tremor in the torso that an individual can have either while they're standing or they're sitting. And then there could be leg tremor that can happen as well at rest, as well as also with prolonged standing. Again, giving us an idea about different kinds of tremor depending upon the distribution in different parts of the body. Another thing we really want to know is there any medication which could be implicated in the cause of tremor? Because we'll go over drug-induced tremor. There are a lot of medications that can cause tremor. And sometime an individual may come and they may say that I started a medicine and 2 days after starting the medication, my shaking started. So it's pretty obvious that, okay, medicine was taken and right after that, the tremor started. So let's stop this and we have our solution. But sometimes it is not that obvious. And an individual may have been on a medication for years or for months before the tremor start. And in that case, reviewing the medication list is really important. Similarly, sometimes there's an adjustment in the dose. An individual may have taken a medication for a long time, and maybe a week or 2 weeks ago, the dose was increased or decreased, and that can precipitate tremor as well. Or it may make an existing tremor worse. So again, reviewing the medication list with the doctor is extremely important. And we want to know that how tremor has progressed. How did it start and how did it progress? Did it start boom just like that one fine morning an individual woke up and they had shaking? Or is this something that slowly came up and it has slowly progressed? Because again, the nature of onset and the clinical course, it kind of varies in different kinds of tremor that we will be talking in a few minutes. And what factors or what activities can make it worse or can make it better? As a general rule, any stressor on the body, so if an individual is hurting because they have a knee pain or they had a bad cold, so they're sick, or they underwent surgery, or they are too anxious, or they're too excited because they're watching a game, all of these stressors in the body can make tremor worse. And that could be despite optimal medical management. That is just a natural response of the body, that any stressor on the body can make tremor worse. So we hear that quite a bit, that I got sick due to some different reason, but my tremor got worse. And once the underlying cause or the associated stressor is taken care of, the tremor kind tends to calm down as well. Similarly, if there are anything that can kind of calm the tremor down, and that is important because there could be certain postures that can bring the tremor out, and kind of alleviating those postures or correcting those postures can help with tremor control. Similarly, we want to know if there are any other associated neurological symptoms. And by that, I mean that if there is any associated speech problem, or there is any associated vision changes or any weakness, because there could be certain conditions going on within the brain structurally that can cause tremor as well. So we really want to know if there's something else that can be attributed to brain that is related with the tremor. And we want to know if there's something else in the body going on outside the brain. So an individual may have a thyroid issue. Thyroid issue is very commonly involved in causing tremor. Individuals whose thyroid levels are elevated, they can have shaking as well. So we want to know anything systemically going on. And then family history. Family history is again important to determine, number one, that what is the risk of an individual of developing a tremor, as well as also essential tremor, the tremor syndrome that we talked about. In 60 to 70% of people have somebody else in the family who had tremor. So it kinds of hint again that what could be the likely diagnosis, and if there's a possibility that it could be seen in the younger generation or not. And then finally, we want to know that if there is tremor, is it bothering in daily routine activities? How much disability it is causing? And the reason I say that is because the medical treatment is guided by this. If an individual has some shaking, but they're able to adjust and adapt, and they can do most of the things of daily living. For example, they can eat okay, they can drink okay, they can hold all right, they can pour, they can button, they can shave. So, those kind of things that require hands on daily basis, if they can adjust and adapt and do those things, and they feel that they do not want to take a medication, then that's okay. So getting a good history or information about the limitations and the disabilities regarding tremor of any kind is extremely important too. So this is an example of somebody who had shaking, and their doctor asked them to make a spiral, and the spiral on the left is something that happened before the treatment was given, and the one on the right was after. So we can see that how extreme shaking can cause the handwriting as well as also drawing affected quite a bit. And then when we are looking at the tremor, we want to notice certain things, which again give us a clue about the diagnosis. We want to see that whether it is about the same every time, so whether it is rhythmical in its appearance, and what is the amplitude. And by that, I mean that how severe it is. Like if somebody is having the hand tremor, then how big is the sway or the vibration or the oscillation that is happening. Similarly, frequency is important because that is also, and again, by frequency, I mean that the number of times the shaking is happening in a specific period of time, because that also gives us a clue about different kinds of tremor. And then again, similar to when we were interviewing an individual, when we are looking at it, we want to see that if there anything that can make the tremor worse or can make it better. So as I mentioned in the previous slide, that there are certain positions or certain postures that can either aggravate or alleviate tremor. So when we are examining, we are looking for that as well. So this is a very busy slide, and I don't intend to go over this because it's quite overwhelming. I just want to give everybody an idea that how many different kinds of tremor exist. This is from the classification of tremor that was devised by a tremor task force in 2018. And this is that all of the movement disorder neurologists tend to follow. But most of the time when we see individuals in the clinic, then the main concern is whether it is related to Parkinson's disease or not. That is the main question, which is a very valid question. But just to give an idea that there are so many other conditions or situations that can cause tremor. So we will try to cover some of them. And the most important concept is that all of us, we have some underlying shaking, which we call as physiological tremor. So I'm sure that most of us have experienced that if we drink too much coffee, we may feel that we are kind of shaky inside. Similarly, if we are too cold, we get that chilly feeling as well. If we are nervous, we're going to do some public speaking or something like that, we may feel that, we are a little bit shaky, and we have seen a lot of cartoons based on that as well. So that tremor, sometime in certain individuals, can become more pronounced, and it may be there most of the time, and it may be something which is visible. So the physiological tremor that we experience is very fine and is very subtle, that we may feel inside, but it is usually not evident to other individuals who are looking at us. But the enhanced physiological tremor, which, as I said, happens in certain individuals, is something which may become noticeable. And that is something which may become pronounced in certain situations. And the most common cause of that is actually stress. So anybody, if they are experiencing anxiety, or if they have post-traumatic stress disorder, also known as PTSD, or if they have fever of certain kind, they can have enhanced physiological tremor. Similarly, certain conditions in general in the body, for example, I mentioned about thyroid before. So if somebody have high levels of thyroid in their system, either because there is an intrinsic abnormality in the thyroid gland, or they are taking thyroid supplements, and because of that, or thyroid medication, and because of that, their thyroid level is high, then they can have some shaking, which is very fine and very fast, could be noticeable at times, could not be noticeable at other times. And that is basically an enhancement of the underlying tremor that physiologically exists in all of us. Similarly, if somebody have low blood sugar, they can become very tremulous as well, again, based on the same principle. And then, as I mentioned before, there are a lot of medications that can cause shaking as well. And we'll go over them in detail in a few minutes. But in general, medicines which are used for COPD can cause shaking. So people may notice that after they take their inhaler, they're a little bit more shaky. And if somebody is taking inhalers multiple times in the day because they have COPD, then the shaking may kind of persist throughout the day, and it may fluctuate depending upon the time when the medication was taken. A lot of psychiatric medicines can cause tremor. The most common ones are lithium, which is used for bipolar disorder, as well as also tricyclic antidepressants, which again are used for a variety of reasons, including different pain syndromes, but they can cause shaking too. Excessive caffeine consumption can cause tremor. So there are a lot of individuals who drink multiple pots of coffee in the day. And if they come and we see shaking, it's extremely important to kind of elicit that kind of information just to make sure that we address that, because in those situations, they probably don't need a medicine. We just need a lifestyle adjustment where we cut down the caffeine consumption and help in improving the tremor. Similarly, exposure to certain heavy metals can also cause shaking in certain individuals. Now, rest tremor, which again, as the name shows, is something that we see in Parkinson's disease and disorders which are related to Parkinson's disease, is something that happens at rest. And whenever we use this term rest, it's extremely important that it is truly that our extremity is still. So if somebody is sitting and their arms are kind of hanging down from the armrest, then that is not truly rest position, because in that position, the gravity is acting against the arm muscles. It has to be completely at rest with the arm and the hand kind of resting in the lap, as an example, or truly resting on the arm rest where the hands or the arms are not hanging off the chair. So that is extremely important to determine. This is one of the classical symptoms of Parkinson's disease, that the tremor, it happens at rest. It can happen in the arms as well as also in the leg. And then, as I mentioned, the jaw tremor, if somebody have that when the mouth is closed, which again is a rest position for the jaw, is indicative of Parkinson's disease as well. But in Parkinson's disease, other kinds of tremor can happen as well. That is the postural and the kinetic tremor, which happen with movements. So even though rest tremor is a classical symptom, but we may see other kinds of shaking in Parkinson's disease too. So I have a video, but I think in order to show this, I may have to stop sharing this screen and share the video separately. Give me 1 minute. See, and you let me know if it works.
Yes, I can see it.
You can see it? Okay, let's start again. Okay, so here you see that how the arms are completely resting on the armrest, right? And there was a shaking. Let's go back a little bit. Yeah, and there was shaking in the hand. And then as soon as the hand was raised, there was a slight decrease in the amplitude of tremor. And then with sustained posture, the tremor came back again. All right, so let's go back to our slides. All right.
Perfect.
All right. So Parkinson's disease is not the only cause of rest tremor. All other conditions that can mimic Parkinson's disease, which we call as secondary Parkinsonism, ism means mimicker. So all those conditions which mimic Parkinson's disease can also present with rest tremor or tremor similar to what we see in Parkinson's disease. So there are a lot of toxic exposures that can cause secondary Parkinsonism, again, where we see the typical Parkinsonian tremor. Similarly, stroke in that area of the brain where Parkinsonism can originate can also present with rest tremor. Traumatic brain injury or TBI involving that part of the brain can also present with similar situation. And the same thing with a tumor in that part of the brain or any diffuse condition that can affect the brain diffusely, particularly those parts of the brain which are implicated in pathogenesis of Parkinson's disease, can also present with shaking, which resemble with what we see in Parkinson's disease. So how do we treat it? Treatment, of course, is very much dependent upon establishing the underlying cause. Once we have ruled out that this is not a stroke or not a toxin exposure, done all the comprehensive evaluation that we do in movement disorder clinics and establish the diagnosis of Parkinson's disease, then we follow the standard treatment plans which are used for Parkinson's disease. The most common medication used is carbidopa, levodopa. I'm not going to go more in detail about this particular tremor because the topic is in general about the tremor and not Parkinson's disease. But just to give an idea that even if tremor is the predominant symptom in Parkinson's disease, the treatment options are from the same bucket, which is used for Parkinson's. So drug-induced tremor, as I said, there are a lot of medicines, right? As this slide shows, it's hard to, you don't have to read it, right? Because it's not for that purpose, just to give an idea that a lot of medicines that can cause shaking. And the most common ones, some of them we discussed, that the medicines which are used for COPD, as well as also used for mental health conditions, they can cause tremor. In addition to this, some of the medicines which can be used for nausea and vomiting, if they're used for extended period of time, again, some, not all of them. There's certain class of antiemetics which can cause shaking. A medicine known as Depakote, a valproic acid, which is used for different kind of mood disorders. It is also used for headache. It is also used for seizures. One of the most common side effects of this medicine is shaking. Similarly, if somebody is on thyroxine or thyroid replacement, they can have tremor as well. Amiodarone, that is a medicine used by cardiologists for the treatment of different kind of heart rhythm disorders, can cause tremor too. And these tremor, which happens because of lithium or amiodarone, they very closely resemble either essential tremor or Parkinson's disease. And at times they may be irreversible, which meaning that even if we take individuals off the medication, these tremor may persist just because of the biochemical changes which are kind of instituted by these medicines. And again, we are only talking about the last two which can cause irreversible irreversible tremor. Most of the medication, when they cause tremor, they are reversible. We take the individual off the medication and the tremor tends to get better and slowly goes away. And how does it look like? The drug-induced tremor or the medication-induced tremor, it can resemble any tremor syndrome that we talk about. It could resemble what we see in Parkinson's disease, so they can have rest tremor. It could resemble what we see in enhanced physiological tremor. They could be only present when an individual is maintaining a posture or when they're doing movements. Or you here see the term intention tremor, which means that the tremor tends to get worse when they approach the target. So, as soon as they're doing the movement, it's okay, or there's some slight tremor, but when they get to the target, the tremor really gets worse. So that is what we call as intention tremor. And all these different appearances of shaking can happen when an individual is taking the medication. Okay, so we have another video. We'll be going back and forth in order to look at these videos. Okay, let me know. You see it? Okay, good. All right, so this is drug-induced. A gentleman who has been taking the medicine lithium, which is used for bipolar disorder. And we see some very fine kind of shaking in his hands, a little bit more so on the right side, you can see. It's present predominantly in the fingers. And then when he's holding his arm sideways, you see it as well. And then when he is approaching the pen, you can see the movement again. So again, this shaking, it resembles very similar to what we will see with essential tremor. We'll see the video for that too. And just to give an idea that the shaking that happens with medication can resemble any other tremor syndromes that we see. All right. So essential tremor is something that we commonly hear about. It is the most common tremor syndrome. The prevalence is pretty high. It could be as high as about 2 to 3% across all the population, but it definitely increases with age. So if we are talking about individuals older than 60, then the prevalence is close to 5%. And if we are talking about individuals above 90, it could be as high as 20%. So there's a understanding that it has a very strong genetic component, because 30 to 70% of individuals who have these, they have somebody else in the family who had shaking. Rest of the group do not. Either they are the first one, or there was somebody in the family who had shaking and they're just not aware of it. Similarly, if somebody has shaking, their first degree relatives have increased risk. But if we look at group of twins, not every twin will have tremor, which means the genetic factor, even though exists, but perhaps there's certain environmental factors as well, which are contributing to the cause of this tremor syndrome. But again, the exact cause, whether genetic or environmental, is still kind of unclear. There have been few genes that have been named, but it's not kind of certain yet. So, if we see somebody in the clinic, unfortunately, we cannot send them to the lab saying that, okay, test them for essential tremor, just because a gene panel for essential tremor has not been established yet, even though few genes have been named. And even though this tremor syndrome, it exists for a long time, it was only until 1998 when, the definitive diagnostic criteria for essential tremor was established. And the essential tremor is labeled as if somebody have bilateral tremor with either sustained posture or with a movement in their hand and forearms, not the rest tremor. And the rest of the neurological exam is normal. Now, in this version of the diagnostic criteria, which came in 1998, it was noted that an individual may have head tremor only without any hand tremor, and they may still have essential tremor. An individual should have this tremor for at least over 3 years. They may have, as I said, positive family history, and they may have beneficial response to alcohol, meaning that if they take alcohol, they may feel that their tremor gets better. Now, this was revised in a few years ago, 2018 actually, and the thing that was kind of removed is the head tremor. So what essential tremor is now defined as somebody having tremor in both upper extremities with sustained postures or with the movement. It should be there for 3 years. And the reason 3-year term is included is to make sure that we do not confuse it with something else, because it tends to evolve. So if somebody have only tremor, maybe 1 or 2 years down the road, they may develop other symptoms of Parkinson's disease. So they want to make sure that the 3-year period is good enough that if a tremor is going to evolve into something else, we're able to rule in or rule it out. That is the reason this time frame is established. And then an individual may have tremor in other locations or body parts, for example, head, voice, or in their legs. And then as in the previous criteria, there should be no other definitive neurological signs to account for. Okay, I have another video for essential tremor. So let's look at that. All right, can you all see it? Yes, okay, so let's play it. All right, so you can see that it's with pouring, how bad the shaking is. A lot of spill there. It's predominantly in the hands. And of course, this is a sustained posture with the movement. So both postural and kinetic tremor that we are looking at. And then as he moved his hands closer, it kind of improved a little bit. All right. So we'll go back. Okay. So there's this term which was introduced again in 2018 known as ET plus. And again, to make it kind of simple is that essential tremor, we already talked about that what essential tremor is. It is tremor in both hands, similar to what we just observed in the video. Essential tremor plus is something in which an individual has same kind of shaking, but in addition to this, they may have very subtle other neurological signs. For example, they may have mild difficulty with walking. They may have some abnormal posturing of their upper extremity or lower extremity, or they may have some memory problems. So again, these signs, these other neurological signs are very subtle and they are not significant enough to be accounted for by another diagnosis, meaning it's not that they have Parkinson's disease. In Parkinson's disease, all those symptoms and signs are very obvious, and we're able to tell that, yes, this is Parkinson's disease. Whereas in ET+, an individual may have very subtle gait impairment or walking difficulty, which is, again, not significant enough for us or for anybody to say that this is like Parkinson's disease or this is like somebody had a stroke. So the impairment is very subtle, and that's what can happen with ET+. So if we look at the demographics of essential tremor, we can see, and this table 2 on the right is quite old, but it still holds true. So age at evaluation, you can see here, if you can see my mouse, is 58.4 years for somebody who on an average, whereas the age at onset was 38 years in men and 41 years in women, meaning that these individuals had tremor for a long time before they went to see a doctor. So the shaking was quite subtle. It stayed at least for a couple of decades before it became obvious and affected an individual's ability to do activities of daily living. And then they sought medical attention. So their duration was, as I said, close to 2 decades. Only 60% of individuals, this was a large group of people who were looked at, 60% of individuals have somebody else in the family who had a tremor. And a big percentage of people also had something else neurologically going on. For example, they may have Parkinsonism, or they have abnormal posturing, which is known as dystonia in the neck or in the arm. So quite a bit of other neurological symptoms can happen, again, as a coexisting condition, not part of essential tremor. And then as far as response to the medication, 60% of people said, or close to 66%, that with alcohol, their shaking tends to get better. And a similar percentage of people had good response to the standard medication that are used for the treatment of essential tremor. Oh, sorry. Okay, so again, as I said, the essential tremor can happen in different body parts. The most common one is hands, as we all know, and the second one is in the head. So a lot of people can have head tremor, and the way it happens is that, you may notice that people may have like no, no, or a yes, yes kind of, then that's how it is described, yes, yes, or a no, no kind of shaking that can happen. And this is followed by voice and leg, and then other body parts as we discussed. And then the age distribution, again, as I mentioned, it's most common in the 2nd as well as also in the 6th decade. And the main feature of essential tremor that it happens with movements, as we noticed in that video as well. And individuals can notice it in different activities of daily living. So, we may see people saying that they're unable to write, they're unable to use the phone, they cannot text, they cannot type on the computer. Individual may have difficulty with brushing their teeth or with shaving, or women can have difficulty with putting the makeup on, or even with dressing, like buttons, it requires a lot of precision. So, individuals may have difficulty with buttons. Carrying a plate, like if somebody's at a buffet, they may have difficulty holding the plate and dishing out. And similarly, eating and drinking. So a lot of things in our daily living that we don't think about, but when an individual have tremor and once it progresses, can really affect an individual's ability to function in the society and can contribute to a lot of limitations. Most of the time, essential tremor, it tends to affect both arms. But sometimes, one arm is worse than the other. And in about 5% of people, this asymmetry is very pronounced, meaning the shaking is significant in one arm and may not be that significant in the other arm. And up to 35% of people may have some rest component to their tremor as well as it progresses. Now, there are several patterns of progression, meaning that early onset, those individuals who had shaking onset, let's say in their 20s, they may have tremor stable, very slight for many years, for decades before it progresses. And that is the reason in that picture or the table that we looked at, that individuals, they waited for a couple of decades before they sought medical attention because the tremor was stable for such a long time. But now we have seen that individuals whose tremors start later in life, for example, in the 6 or 7 decades, they progress very quickly. For some reason, their progression is more pronounced and more quick. And they are the one who fall more under the category of ET+, meaning that they may have walking difficulties, memory problems, thinking issues, all of those. So early onset are relatively slow and they're relatively benign. They do not have any other neurological problems. Whereas late life onset, they progress quickly and they have a lot of other issues as well. And then we kind of discuss the modifiers that it get worse with stress, anxiety, excitement, pain, lack of sleep. It improves with alcohol. So it's really important that when we talk about treatment, that one avoid the triggers. The diagnosis of essential tremor is clinical, which means that we rely on the interview and on the exam. And of course, we have to review the medication list to make sure that none of the medicine is contributing either to the worsening of the underlying essential tremor or to triggering it. Labs may or may not be needed. If there is somebody who has symptoms suggesting a thyroid problem, we can go ahead and do that. But again, if there's nothing to suggest that, then we don't really need any lab work to establish the diagnosis of essential tremor. Similarly, CAT scan or MRI is not needed for essential tremor because essential tremor is more of a software problem. So it's not a hardware problem. If we do a CAT scan or MRI, it is going to be normal. So in order to establish the diagnosis, all we need is to do a good interview, make sure that we rule out other neurological things on the examination and establish the diagnosis accordingly. Now, having said that, overdiagnosis is very common. There was a big study in which they looked at the diagnostic accuracy of essential tremor, and it was noticed that close to 30 to 50% of cases who were labeled as essential tremor were not essential tremor. The important diagnosis which was missed was Parkinson's disease. And then there were other diagnoses which were missed, like dystonia, which is the abnormal posturing due to overactive muscles, and then ataxia syndromes. Another important thing which was missed was the enhanced physiological tremor that we talked about. So overdiagnosis or missed opportunities definitely can happen in certain cases. Now, what are other kinds of tasks of essential tremor which were previously labeled, but now they are more task specific? Is that an individual can have primary writing tremor, that they do all other activities and they do not shake. But whenever they start writing, they have shaking. So that is primary writing tremor. Similarly, there could be other task-specific tremor. As an example, if somebody is a musician and they play a guitar or a violin, and whenever they are doing that particular activity, they may have shaking. Isolated voice or chin tremor or dystonic tremor is something that we talked about before. So essential tremor, even though for the longest time has been considered as something which only has tremor, but now we know that it can have other features, for example, memory difficulties, walking difficulties, or behavioral issues like excessive anxiety or depression, again, predominantly more in the late onset essential tremor. Now, an important thing is that how do we differentiate that whether this is essential tremor or whether this is Parkinson's disease tremor? So essential tremor is symmetric. Most of the time it's present in both arms, whereas Parkinson's disease tremor is asymmetric, meaning it's more common or predominant on one side. And that asymmetry is very pronounced in Parkinson's disease for the longest time. In essential tremor, the tremor is predominantly with sustained postures or with movements, whereas in Parkinson's disease, it is primarily at rest. And in essential tremor, there's no stiffness, no slowness, and no other obvious neurological symptoms and signs. Whereas in Parkinson's disease, there's a lot of stiffness and slowness of movements, and there are a lot of other neurological and non-neurological symptoms as well. Now, how do we treat essential tremor? So treatment is very patient-centered. There's no standard guideline. Every individual is different, and therefore the treatment regimen is tailored according to an individual. Most of the time, the treatment is guided by the degree of disability, as well as also if an individual is embarrassed by it socially. There are different approaches. One approach is that we can just watch it and not do any treatment if it is not causing any physical or social impairment. The other option is that we can do different non-medication approaches, meaning that we can teach individual different adaptive strategies. So we always talk about, actually we'll talk about this in a couple of slides later, but just in general, if somebody is going to eat and they use plasticware, they will be very shaky. So we have to make sure that an individual use regular silverware. The lighter things we hold, more shaky we will be if we have shaking. Similarly, the more the arms are away from the body, they will be more shaky. But if the arms are braced and the body is used as a support, then the shakiness may kind of decrease or lessen. So there are these adaptive strategies that can be used for a while an individual is doing the activities of daily living. And then, of course, there are options to treat via medication, and there are surgical options as well. Now, there are a few medicines that I will cover here. One is propranolol, which is actually a blood pressure medicine, but it is used as one of the first-line medication for treatment of essential tremor. It is not given to people who have heart rhythm issues or who have bad lung problems due to asthma or severe COPD. And the dose range could be from 60 to 320 milligram daily. It is available as a short and long-acting formulation, so it can be taken multiple times in the day, or it can be taken like once a day medication. And it is only one of those medicines for essential tremor that can be used as needed. And what I mean by that if somebody have shaking and they're going out, let's say for dinner, and they really want to make sure that they're going out, with friends in a restaurant, that they are not shaking, then they can take a pill of propranolol if their doctor allows 30 minutes to an hour before they're going to the event. Some of the common side effects with propranolol include lightheadedness. Since it is a blood pressure medicine, it can lower the blood pressure. It can cause fatigue. It can cause worsening depression. Primidone is the other medicine. It was originally discovered as an anti-seizure medication, but it's no longer used for seizures. It is actually exclusively used for tremor treatment. One of the common problems with primidone is that it can have drug interactions. So we have to be very careful when prescribing this medicine, carefully review the medication that an individual is taking, and make sure that there's nothing else being taken which can interact with primidone. It's a barbiturate, so it does show up in the urine drug screen. So if somebody is taking it, they have to make sure that they alert, their other physicians. It cannot be given with blood thinners just for the same reason that it can cause drug interactions. We start slowly and then gradually increase the dose, and it can be given up to 750 milligram. The common side effects with this medicine is nausea, dizziness, and sedation. Topiramate, also available as Topamax, is also one of the seizure medicine, but topiramate is used for a lot of different reasons, including essential tremor. Typically, we have to give higher doses of topiramate in order to achieve good tremor control. This medicine is not given to people who have kidney stones or who have glaucoma, so something that needs to be checked before the medicine is prescribed. Common side effects include poor appetite. It can cause weight loss. It can cause a lot of tingling in fingers and toes initially. And then in some people, there could be some cognitive slowing or dullness of thinking that can happen. Gabapentin is another medicine that can be used. It was also initially prescribed as anti-seizure medicine, but now it is used for a lot of other reasons. It's one of the second-line medicines, meaning that it's a mixed bag. Some people may respond to it, some people may not. The side effect includes sedation and weight gain with gabapentin. And then, there are a bunch of other second line medications that can be used for essential tremor, again, with a kind of a mixed response, like benzodiazepine, in which, clonazepam or Klonopin is one of the medicine. Other beta blockers, which are used for blood pressure, like metoprolol or atenolol, can be used. Carbidopa, levodopa, which is used for Parkinson's disease, can be used too. And then Botox injections can be used in individuals who do not respond to medicines. So as you can see that the list of really good medicines for tremor is pretty short. There are 2 or 3 medicines that we can say with certainty that, that yes, these are going to help. The first two, propranolol and primidone. The rest are more of a second line medications, which may or may not help. So occupational therapy is something that can help a lot because they can teach different adaptive techniques to overcome the tremor. And they can also provide different adaptive utensils that can be used if somebody has shaking. So what they teach is that an individual should use proper body mechanics. There should be core stability when somebody is doing something while using their hands. And as I mentioned, tucking the elbows inside toward the body, they give stability to the arms and the shaking may be less pronounced. Similarly, if somebody is writing and they're writing like this, they may be shaky. But if they put their arm on the table and then they try to write, there may be more stability when they're writing. There are different kind of utensils. For example, there are different spoons and fork and knife that are designed for people who shake. Mugs with lids or straw can be used in order to avoid spilling when somebody is drinking. If an individual is having problem with writing, then they can use pre-filled bank slips, so that they are not really struggling with signing their name when they're standing at the bank desk, or using pre-printed address or name stickers. Similarly, if you're doing something tedious, which require a lot of motor details, then try to complete the task when you have the most energy. Because the more tired one individual is, more shaky they will be. Other techniques that can be used if the shaking is significant, then electric razor or electric toothbrush can help. There are long handle combs that can help. Similarly, for dressing, using snap buttons or Velcro closures for shoes and things like that can be really used as good adaptive techniques. There are button hooks which are available for buttoning. And then I have some, and especially people who type a lot in the computer, there are now softwares that can be used instead of a regular computer mouse, which is difficult for people who have a lot of shaking. And then there are keyboards with large buttons as well for individuals who have tremor. So some of the pictures, these are the silverware that is designed for people who have essential tremor. There is a kind of a smart spoon as well, smartware. So there is a vibrator inside the handle. And when it is turned on, it tends to offset the tremor which is present in the hand. So this is pretty useful for a lot of people. And then some people don't like it, but it is definitely a tool available or a resource available to utilize if somebody wants to try it. Similarly, there are different pens which are made more heavy and weighted in order to give a better grasp. There could be functional kind of heavy mittens or gloves or functional wrist weights that can be used when an individual is doing fine motor activities. All right, so getting close to the end, one option for treatment is Calatrio. And rather than reading this, I'm just going to show you the picture. So this was approved a couple of years ago, and what it is a band which an individual can wear. And this band has a couple of sensors. So these sensors, they tend to align with the nerves in the wrist across the wrist, and they tend to stimulate those nerves. And then the impulses, they travel through those nerves to the brain and then tend to modify the tremor. So this band, it needs to be charged. And of course, there's a base station which is provided. In one setting, you can wear this band for about 40 minutes. And the effect after the band is taken off lasts for about an hour. And it can be used for about 2 to 3 times per day. If we look at the study, the results were reported that it tends to improve the tremor in a big percentage of patients. In our clinical practice, the number, it kind of varies from about, I would say, 50 to 60% of people reporting that there is some tremor improvement when they wear this. Now, keep in mind, though, it cannot be used by people who already have an electrical device in their body. So if somebody have a pacemaker or a defibrillator or a spinal cord stimulator, then they cannot use the Calatrio or this band. And then there are surgical options for the treatment of essential tremor. Deep brain stimulation is something which was approved for essential tremor in 1998. And it is like a pacemaker of the brain. So there's a battery that's placed in the chest wall, and it's connected by wires to the leads which are placed inside the brain. It's approved for essential tremor and also for Parkinson's disease. So the targets in the brain, it vary depending upon the diagnosis. It can be done for both sides. It is something which is modifiable. So as the tremor progresses, we can modify the amount of current that is being delivered and continue to provide benefit regarding the tremor control. So it's not a cure. It is also a form of treatment, but it definitely helps to take individuals off the medications. And the initial few years, the tremor control is really excellent. Now, focused ultrasound is something which was approved by FDA for a tremor treatment in 2016. And what is done is that in the MRI machine, the brain images are acquired by the surgeon. They're able to define the target. And then through the ultrasound machine, they're able to deliver ultrasound waves to that particular target. Actually, the target is the same where the DBS leads are placed. And then that target is kind of ablated or is burned in order to interrupt the pathways which are causing tremor. So this is a non-invasive procedure, which means, we don't have to drill holes and do all of those things which are done for DBS. It's kind of a non-invasive thing. Only the frame is placed and then the individual is in the MRI for 3 to 4 hours. So we do have to let them know that the head will be shaved and then you have to lie down in the machine for 3 to 4 hours. And it's done only for one side. So if the tremor is there on both sides, we have to identify that which side is more important for an individual's functionality. So only done for one side. And as it was approved in 2016, we do not have a long-term data, but for the initial years, the outcome has been pretty close to a deep brain stimulation, with the difference that it's only done for one side, whereas DBS is done for both sides and it's modifiable, and the DBS is more of an ongoing therapy, and focused ultrasound is something which is done only once, and and that's pretty much. So just to go over, in general, what is the treatment algorithm? As I said, this is very patient-centered. When somebody comes with tremor, we have to establish the diagnosis of essential tremor. We provide them education and support, and then we see if they need the treatment or not. If they are not really impaired by any in their daily routine, then we don't have to treat it. We are not hurting anybody by not giving medicine. But if there's a need, then yes, we can give the medicines. And as I said, the top medicines are propranolol and primidone, and topiramate as well. We can use them in combination too. If the therapy is not successful because the tremor is progressing, then we can add other medications, including Botox injections. And as the tremor progresses, if the therapy is not successful, then we can go to the surgical options. I think in interest of time, I'm going to skip this. I just want to cover two more tremors. One is the dystonic tremor, which presents like essential tremor, but it is associated with abnormal posturing of hands. So, we will see that the fingers are kind of deviated, something like this, and the shaking is happening. In essential tremor, the position is normal. In dystonic tremor, there's abnormal posturing that can happen. There could be pulling of the head, and then you may see shaking with that. So, it's really an abnormal posture associated with shaking. And botulinum toxin is the treatment of choice for that. I think let me skip that as well. And then cerebellar tremor, again, is something that happened with lesions inside the brain. Is that part of the brain which is involved with balance and coordination. And that shaking is also very pronounced, very disabling. It's more with the targeted movements that we see this kind of shaking. And treatment, again, is unfortunately not many options. The same options that are used for essential tremor can also be used for cerebellar tremor. And then in different neuropathies, this is something that a lot of individuals experience, peripheral neuropathy. Peripheral neuropathy, if it is present extensively in the arms, can also cause shaking. and this shaking is more in the upper part of the arm. So if an individual is holding their arms like this, we may see that they are having shaking like this. Instead of like this, the shaking is more at this level. So neuropathy can definitely cause shaking as well. And again, this shaking treatment is a little bit difficult because we don't have specific options for treatment of this kind of tremor. We really have to focus on treating the neuropathy in order to treat the tremor. So in summary, the tremor is one of the most common movement disorder. Hands are the most common site which are involved. And there are multiple causes for tremor, but essential tremor is the most common one that we see. And the prevalence of essential tremor, it increases with age. There are treatment options which are available, but they are limited, not only in medication, but the surgical treatment as well. But definitely this is an evolving field. Over the last few years, we have seen different surgical options which have been approved, and they are really helpful with excellent responses, at least in the time frames that we have available for monitoring. And for the treatment, it's very patient-centered. There's not one generalized rule of thumb. Everybody is different, and based on an individual, the treatment, the regimen is kind of designed. So I think I will stop here and take any questions. Thank you.
Thank you. This was wonderful. So we do have a couple of questions specifically about the tools. I put the Calotrio information into the chat, but some of the tools you showed, like the weighted silverware, is there something you specifically recommend?
So what we do is that we typically refer individuals to occupational therapy, and they are able to evaluate individual on those different tasks, and they can determine that which tools can help an individual the most. There are different companies, different vendors who make these devices. I don't want to, like kind of cherry pick names, but as I said, the best resource is to see an occupational therapy and let them guide that which tool would suit an individual the best.
Okay. And then we had a question. Is there such a thing as internal tremors?
Yes. So there's not a specific term, but yes, an individual who have essential tremor, they have this feeling of vibration within their core. So this is not like a new term, definitely people will come and they would say that it's just not my hands shake. I have this feeling of vibration within myself. And surprisingly enough, this sensation is responsive to medications in a lot of individuals.
And then I'd actually never heard of Botox for treatment in tremor, but someone said if you have tremor in both hands, where would they do the Botox?
So the Botox for tremor, the Botox use or botulinum toxin use is an off-label use. It is not an FDA-approved indication yet, but most of the movement disorder neurologists, once the tremor advances and the medications are not working or helping, before sending an individual for invasive surgical options, botulinum toxin is tried because it does help in 50 to 60% of individuals. And usually, think about this, Botox, what it does is that it tends to decrease the activity of the muscle, which we think is doing too much. That's how Botox works for any disorder that it is being used. And the hand muscles are actually originating in the forearm. So the injection of Botox is typically done in the forearm at different sites. So we have to see that what the tremor look like. And based on that, we're able to identify that which muscles are involved, and we inject into those muscles. And as I said, predominantly these muscles are in the forearms, sometime a muscle or two in the arm as well, depending upon the extent of the tremor. So if somebody have tremor in both hands, then of course they get injections in both of their forearms or arms.
And then the last question, because we're out of time, can you elaborate on the effect of alcohol on tremor?
So only essential tremor is the one that responds to alcohol. Having said that, alcohol is not recommended as a treatment option, right? Because excessive alcohol intake can cause another kind of tremor, which is very difficult to treat. So, for the longest time when the medication options for essential tremor were very limited, at that time, alcohol was recommended, again, in very small amount as needed for certain events. But now we have substituted that with propranolol, because propranolol can also be used for a similar reason. There are multiple trials now which are kind of developing byproducts of alcohol that are efficacious in the management of essential tremor. But again, that is something which is investigational, and it's not alcohol itself. It's one of the ingredient of it. So the effect, of course, on other body parts and all the toxicity that can happen with intake is not there. But it's investigational, and once it comes, then of course that will be an option available to treat.
Wonderful. Well, this was an incredible program. Thank you so much
Sure.
about for being here today, for gifting us with your time.
Thank you so much.
We have a tradition here at PMD Alliance, our wave of gratitude. Thank you so much, and thanks everyone for being here today. You have a
Thank you.
wonderful
All
afternoon.
right. You too. Bye-bye. Take care.